Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This video is on heart attack symptoms that you should never ignore. Heart attack and other heart disease remains the #1 cause of death in the United States. But if you recognize these symptoms early and act fast, you can save your life. So this is a really important topic that you need to know about. We're going to be covering what a heart attack is, the common symptoms, the less common symptoms, when to call 911, and how to prevent a heart attack. Now, if you like content like this, be sure to subscribe and leave a comment down below letting me know what health topics you'd like covered in future videos. In addition, if you have any questions, leave them in the comments and I will answer all of them. Before we begin with heart attack symptoms, remember that these videos are for education purposes only. I cannot give personalized medical advice here. So if you're having any symptoms, or if you think that you're suffering from heart disease, talk to your doctor right away. And if you think that you're having a heart attack, call 911. Now, let's get started with heart attack symptoms that you should never ignore. A heart attack is a blockage of one of the coronary arteries, which supply blood to the heart tissue. This can result in damage to the heart tissue or even death to the heart tissue. The heart is the most important organ of the body. It keeps us alive by supplying blood that is rich in oxygen and nutrients to the entire body. If part of your heart gets significantly damaged because of a heart attack, this could have serious consequences for your body and could cause death. The symptoms of a heart attack can vary greatly from person to person, and there are many reasons for this. We have multiple coronary arteries that supply blood to different parts of the heart, and depending on which coronary artery gets blocked, that can result in different types of symptoms. In addition, the nerves which send signals from the heart to the brain overlap with other nerves in the body, and the brain can confuse these signals. This is why patients who have a heart attack often experience pain in other parts of the body that seemingly have nothing to do with the heart, places like the jaw or the shoulder or the back or the arm. Other factors that may affect what symptoms someone experiences with a heart attack include gender, age, base level of physical fitness, mental health, and chronic medical conditions like diabetes. The classic symptoms of a heart attack include severe chest pain, which may radiate to your shoulder, your arm, your jaw, your neck, or your back, shortness of breath, especially when you're exerting yourself, sweating, feeling nauseous, or feeling dizzy. You may experience a heart attack without classic symptoms. The following are symptoms that are more subtle and are often missed. These symptoms include chest pain that is more mild, that comes and goes, pain in other places of your body without chest pain. This may include upper back pain or jaw pain. You may experience pain in your upper abdomen that feels more like acid reflux pain. You may experience intense anxiety, like something terrible is happening. In addition, you may feel fatigue that is different than normal fatigue. The atypical symptoms of a heart attack that we just discussed are more commonly experienced in women and in elderly patients. Now, it can be frustrating knowing that there are many different symptoms that one could experience with a heart attack. How does one know when you're having a heart attack versus something else? My advice about that is to think about your normal state of health. If you experience symptoms that are typical to what you often experience in the past, then this may be less likely to be a heart attack. On the other hand, if you experience symptoms that just started and that feel different than how you normally feel in your day-to-day life, this is more likely to be something serious, like a heart attack, and you should get help. When should you call 911? Calling 911 because you think you may be having a heart attack is never the wrong answer. On the other hand, the symptoms that are most concerning for a heart attack include severe chest pain that lasts more than a few minutes, the sudden onset of feeling short of breath, passing out, even if it's for less than 1 minute, or feeling like you're about to pass out. If you're experiencing any of these symptoms, don't hesitate. Call 911 now because this may save your life. Some important things that I don't want you to do. Number 1, don't drive yourself. It's too dangerous to drive if you may be having a heart attack, so call 911 instead. Number 2, don't delay getting care because you're waiting to see if your symptoms go away. If your symptoms have already lasted for at least a few minutes, call 911 now. Number 3, don't delay getting care for symptoms that are new. Chronic recurring symptoms are one thing, but if you're experiencing brand new symptoms that may be a heart attack, call 911 right now and don't delay getting care. How do we prevent heart attacks? Luckily, there are many things that you can do right now which are proven to help to prevent heart attacks. Eat healthy, lots of fruits and vegetables, exercise, maintain a healthy weight, don't use tobacco products or nicotine products, manage your stress. We all get stressed, but it's important to manage your stress in a healthy way. Avoid high cholesterol, avoid high blood pressure, avoid diabetes, and if you do have diabetes, make sure that you work hard to keep your diabetes under control. That's it for today. Thank you for watching. Be sure to subscribe and leave a comment down below letting me know what health topics you'd like covered in future videos and if you have any questions. Remember, these videos are for education purposes only, so if you're having symptoms or if you think you're suffering from heart disease, see your doctor right away. And if you think you might be having a heart attack, call 911. Bye-bye.